If you're over 60 and you've been brushing off that lingering cough as just another sign of getting older, what I'm about to tell you could literally save your life. Here's something most people never realize. Nearly 40% of chronic coughs in adults over 60 have absolutely nothing to do with a cold or flu. They're warning signals from your body about serious conditions like heart failure, blood pressure medication problems, or even lung diseases that are completely treatable when caught early. But here's the scary part. The average person waits over 8 weeks before seeking help for a persistent cough, and by then, what could have been easily managed becomes a life-threatening emergency. I'm going to share 7 critical warning signs that separate a harmless cough from one that demands immediate attention. And the most important tip that could prevent a medical crisis is coming at the very end, so please don't miss it. This isn't about scaring you. It's about empowering you with knowledge that could change everything. The truth is, your body after 60 is incredibly resilient and capable of healing, but only when you know how to listen to what it's telling you. Too many people accept declining health as inevitable, but that persistent cough might be your body's way of asking for help with something completely fixable. Before we dive in, I want to hear from you. How long have you or someone you love been dealing with a cough that just won't go away? Write the number of weeks in the comments below, and I personally respond to every single person because your experience matters and might help someone else recognize their own warning signs. Let's start with something that catches most people completely off guard, the heart failure cough. This isn't the dramatic chest-clutching heart attack you see in movies. This is your heart gradually losing its ability to pump blood effectively, and one of the earliest signs is a dry, persistent cough that gets worse when you lie down at night. Picture this. You're trying to sleep, but every time you get comfortable, you start coughing. You prop yourself up with extra pillows, thinking it's just congestion, but what's really happening is fluid backing up into your lungs because your heart can't keep up with its workload. The cough often comes with subtle fatigue that you might blame on age, or slight swelling in your ankles that seems to come and go. Here's what you need to do right now. Pay attention to when your cough happens. If it's consistently worse at night or when lying flat, and especially if you notice any swelling in your feet or legs, this needs medical attention within days, not weeks. Don't wait for dramatic symptoms. Early heart failure treatment can add years to your life and dramatically improve how you feel every single day. The medication cough is another silent troublemaker that affects millions of people over 60, and most never connect the dots. ACE inhibitors, those blood pressure medications with names ending in pril, like lisinopril or enalapril, cause a dry, tickling cough in about 15% of people who take them. The frustrating part is this cough can start anywhere from days to months after beginning the medication, so you might not even remember when it began. It's typically a dry, non-productive cough that feels like there's something tickling the back of your throat constantly. The good news is this is completely reversible, but many people suffer unnecessarily because they don't realize their life-saving blood pressure medication is the culprit. Here's your action step. Make a list of every medication you started or changed dosage on in the past year, including over-the-counter supplements. Take this list to your pharmacist or doctor and ask specifically about cough as a side effect. Often, switching to a different type of blood pressure medication called an ARB can control your blood pressure just as effectively without the cough. Don't stop any medication on your own, but definitely start this conversation. Acid reflux cough is probably the most misunderstood cough affecting people over 60 because it doesn't always come with heartburn. As we age, the valve between our stomach and esophagus can weaken, allowing stomach acid to creep up into our throat, especially at night. This creates a chronic cough that's often worse in the morning or after meals, and you might notice a sour taste in your mouth or feel like you need to clear your throat constantly. What makes this particularly tricky is that the cough itself can worsen the reflux by increasing pressure in your abdomen, creating a frustrating cycle. Many people try cough suppressants that don't work because they're treating the symptom, not the cause. Here's a simple test you can try. Elevate the head of your bed by 4 to 6 inches using blocks under the bed frame, not just extra pillows. Avoid eating within 3 hours of bedtime, and notice if your cough improves over the next week. If it does, you've likely identified acid reflux as your culprit. Simple dietary changes like avoiding spicy foods, citrus, and caffeine in the evening, combined with smaller, more frequent meals, can make a dramatic difference. The infection cough that won't quit is especially dangerous for people over 60 because our immune systems don't always mount the dramatic fever and obvious illness signs that younger people experience. You might have a low-grade bacterial infection in your lungs or sinuses that's just persistent enough to cause ongoing inflammation and coughing, but not severe enough to make you feel obviously sick. This is particularly common if you've had a recent cold or flu that seemed to resolve, but the cough lingered. What's concerning is that untreated bacterial infections can worsen over time, potentially leading to pneumonia or spreading to other parts of your body. The key warning signs are a cough that's lasted more than 3 weeks, especially if you're bringing up colored mucus, yellow, green, or brown, or if you have any low-grade fever, even just feeling slightly warm in the evenings. Here's what you need to know. A simple sputum culture or chest X-ray can identify bacterial infections that respond beautifully to the right antibiotic. Don't assume that because you don't feel terribly sick, there's nothing wrong. Your action step is to see your healthcare provider if your cough has persisted more than 3 weeks, especially if it started after a cold or flu. Chronic obstructive pulmonary disease, or COPD, often announces itself with what people dismiss as a smoker's cough. But here's something crucial. You don't have to be a current smoker to develop COPD. Even if you quit decades ago, or if you were exposed to secondhand smoke, dust, or chemicals throughout your life, COPD can develop gradually, and the early signs are subtle. The characteristic cough produces mucus, especially in the morning, and you might notice you're slightly more short of breath climbing stairs or walking uphill than you used to be. What's heartbreaking is that people often attribute these changes to normal aging and delay getting help until the disease has progressed significantly. But early COPD responds incredibly well to treatment. Medications can slow progression, pulmonary rehabilitation can improve your breathing capacity, and lifestyle changes can add years of active, enjoyable life. Pay attention to a combination of persistent cough with mucus, shortness of breath during activities that used to be easy, and frequent respiratory infections. If this sounds familiar, ask your doctor about a simple breathing test called spirometry. Caught early, COPD becomes a manageable condition rather than a life-limiting disease. Postnasal drip might sound harmless, but for people over 60, it can become a persistent, annoying problem that significantly impacts sleep and daily comfort. As we age, our sinuses don't drain as efficiently, and medications we commonly take, like blood pressure pills, antihistamines, or antidepressants, can thicken mucus or dry out nasal passages in ways that worsen drainage problems. The result is a constant feeling of mucus dripping down the back of your throat, leading to frequent throat clearing and a cough that's often worse at night. You might notice you wake up with a scratchy throat or need to cough and clear your throat frequently throughout the day. This isn't just annoying. Poor sleep from nighttime coughing affects your immune system, energy levels, and overall health. The solution often involves a combination approach. Start with a saline nasal rinse twice daily using distilled or boiled water. This helps thin mucus and flush out irritants. Consider using a humidifier in your bedroom, especially during winter months when indoor air is dry. If you take multiple medications, ask your pharmacist which ones might be contributing to dry mouth or thick mucus. Sometimes simple changes, like switching when you take certain medications or adjusting the humidity in your home, can provide remarkable relief. The lung cancer cough is the one everyone fears talking about, but knowledge here truly can save your life. Lung cancer doesn't only affect heavy smokers, it can develop in anyone, and the early warning signs are often subtle. The concerning cough is one that changes in character. Maybe you've had a mild morning cough for years, but suddenly it's more persistent. Or you're coughing up blood, even just streaks in your mucus. Sometimes the cough comes with unexplained weight loss, fatigue that seems disproportionate to your activity level, or chest pain that comes and goes. Here's what gives me hope. Lung cancer caught early has dramatically better outcomes than it did even 10 years ago. New screening guidelines recommend low-dose CT scans for people who have smoked heavily, but even if you don't meet those criteria, any significant change in a chronic cough warrants investigation. Don't let fear keep you from getting answers. A chest X-ray or CT scan can provide reassurance or catch something early enough to treat effectively. If you notice any blood in your mucus, unexplained weight loss, or a significant change in a long-standing cough pattern, this needs medical attention within days, not weeks. Let me bring this all together for you, because recognizing these patterns could truly change your life or the life of someone you love. That persistent cough isn't just aging, it's your body communicating important information about your health. Whether it's heart failure, medication effects, acid reflux, lingering infection, COPD, postnasal drip, or something more serious like lung cancer, every single one of these conditions responds better to early treatment than waiting until symptoms become severe. Your body after 60 is remarkably capable of healing and adapting when given the right support and attention. The key is learning to distinguish between normal aging and signs that need medical attention. A cough that persists more than 3 weeks, changes in character, interferes with sleep, or comes with other symptoms like shortness of breath, swelling, or fatigue, deserves professional evaluation. Remember, even small changes in how you approach your health can have profound impacts. Whether it's elevating your bed for acid reflux, reviewing medications with your pharmacist, using a humidifier for postnasal drip, or simply paying closer attention to when and how you cough, you have more control over your health than you might realize. You're not alone in this journey, and you don't have to accept declining health as inevitable. Your body is constantly working to maintain your health, and sometimes it just needs a little help or attention to get back on track. If this information has been helpful, please give this video a thumbs up and subscribe to our channel for more practical health advice specifically designed for people over 60. Turn on notifications so you never miss important health information that could make a difference in your life. Most importantly, I want to hear from you in the comments. Which of these warning signs surprised you the most? What other health topics would you like us to cover? Your questions and experiences help guide our content and might provide exactly the information someone else needs to hear. Share this video with friends or family members who might benefit from this information. Sometimes we notice changes in our loved ones before they notice them themselves.